This episode is sponsored by Circle and Bloom. Circle and Bloom has created an amazing offer for the Fertility Friday community. Make sure to head over to circlebloom.com/fertilityfriday to get your free relaxation program. And don't forget to enter the coupon code Fertility Friday at checkout to get 20% off of anything you buy. This is the Fertility Friday podcast, episode number 106. Welcome to the 106th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. Before I jump into today's interview, I just wanted to take a moment and let you know about my new group programs that are coming out in January. So I recently completed my 10-week group program that I had going on since August. We started in mid-August, and it was just an amazing experience. So I was working with a small group of women. We met every single week, and not only did we delve into fertility awareness charting and really get a handle on what all the mucus stuff means and how to sort it all out, we also really started to get a handle on what's happening, what are the underlying factors that are contributing to cycle irregularities. And so it was just my complete privilege and honor to work with such an amazing group of women and to see how they were supporting each other and there for each other. So let me tell you, there's just something really powerful about working in a group. And I know that firsthand because that's how I learned to chart as well. And so that's why I'm so passionate about creating that experience and opportunity for you. And I'd also like to share with you what one of my clients recently said about her experience.
Absolutely do it. You can't lose anything except for being empowered by your own body and empowered by knowledge that you will have that you are shocked that you didn't know. I mean, I learned so much from Lisa's podcast just from listening to it obsessively, but there was even more things I learned that I had no idea. Like, I mean, I swear after every session, I'm going to my husband and be like, oh my gosh, did you know? Did you know this? And I'm telling my girlfriends and they're like, what are you talking about? There's so much, it's really empowering as a woman to know about your body. And I feel like you can only get more of that by taking a class.
So make sure to head over to fertilityfriday.com/group program for more information. I just wanted to take a moment to thank my sponsor, Circle and Bloom. I am so thrilled to be working with such a great company. And to be honest, I've had just an incredible amount of positive feedback from my clients, from my listeners, from the members of the Fertility Friday Facebook community, and otherwise members of the community in general. Every time I post about Circle and Bloom, somebody comments and just thanks me for partnering with such a great company. So I couldn't have asked just for a better business relationship with a company that's so supportive of my audience. And so one of the things that I really love about the programs through Circle and Bloom is just the detail and the intention behind them. So for example, the Natural Cycle Fertility Program, which is one that I've spoken about before, it takes you through a 28-day cycle where each visualization is unique and different based on what's happening in your cycle at that time. So we all know by now that all of our cycles are not always 28 days, but the beauty of charting is that you can actually pinpoint where you are in your cycle. So you can listen to the visualization at the right time and you know what time that you're at when you're charting your cycles. And so I would encourage you to head over to circlebloom.com/fertilityfriday and make sure to download your free fertility relaxation MP3. And if you do choose to purchase any of Circle and Bloom's programs, just remember to enter the discount code Fertility Friday at checkout to redeem your 20% discount, which is super generous. So thank you, Circle and Bloom. And without further ado, let's jump into today's episode. And today I'm very excited to welcome my guest, Nora Pope, to the show. Nora is a board-certified naturopathic physician and Creighton Model fertility care practitioner in Toronto. She helps adults and children find relief from infertility, seizures, allergies, insomnia, high blood pressure, and other hormonal imbalances. She's an expert in drug-herb interactions and prescribes natural medicines which enhance the efficacy of prescription medications. She advocates the midwifery model of natural birth and eco-friendly fertility appreciation with the Creighton Model fertility care system. and she supports couples to conceive naturally. Nora is also the author of several articles and book chapters on the naturopathic treatment for epilepsy, women's health, and fertility. And in today's show, we're going to be talking about fertility awareness, and I'm particularly interested in the naturopathic application of the Creighton model fertility care system, because as many of my past listeners know, I've had a NAPRO doctor on the show as well as a fertility care practitioner. NAPRO is a medical application of, fertility awareness as a diagnostic tool, and so I'm really excited to delve into that with Nora. And as a side note, Nora is in front of me. We're doing the very first in-person Fertility Friday podcast episode, so I'm really excited to have her. So thank you for being on the show and coming to my home. This is so nice.
Thank you for having me, Lisa.
Well, thank you again for being here. And so, before we get into everything, I'd just love to hear a little bit more about how you started in this work in the first place.
Sure. Well, my mother had 7 children. Her mother had 11 children, and both my mother and grandmother were suspicious of the medical establishment because my grandmother was told when she was 25 that she was infertile. Well, anyway, that wasn't the case. And she gave birth to 11 children at home, and that was the custom in Belgium in the 1930s. Then my mother had very unpleasant experiences giving birth to her first 3 children. She was knocked out under anesthetic without her consent. Both my parents, even though they were from Rosedale and were very establishment, had a very bohemian, natural view of childbirth and human reproduction. So my dad fought to be in the delivery room, and he wasn't allowed. And I was the only baby of his 7 that he saw actually be born, because it was 3:00 in the morning when I was born. So I think that's why I'm still a night owl. But my parents have always been very independent thinkers, have always questioned the status quo. That's part of my DNA. So in terms of naturopathic medicine and fertility awareness, I've always been interested in thinking out of the box. I've always been interested in what's good for the planet, what's environmentally friendly, and also getting to the root cause and being detective. So I think for so many people, you go to the doctor and medicine's practiced in silos, and it's a very on-off switch kind of approach. And I was interested in naturopathic medicine because it appeals to the detective in me, and it appeals to, the curious person in me. And then also I knew a lot of women that I really admired who were on the board of the Marguerite Bourgeois Center, which is now Fertility Care Toronto, and they asked me to get involved. I haven't even heard of charting. So this was in 1994. I go, this is fantastic information, because learning about your cycle ceased to be just about making babies. It was a health tool. It was a predictor of health. So if you had crappy periods, there's something going on, and let's find out what's going on. And a lot of the time, a hormonal balance or maybe low progesterone could have been a trigger for all kinds of things. And unfortunately, in most medical circles, progesterone was a dirty word, because artificial progesterone, which is found in the pill, is the toxic kind of progesterone. And so the generic name progesterone lingered in terms of its toxic side effects. But natural progesterone, or bioidentical progesterone, or human identical progesterone, which can be synthesized or come from plants, is human identical. And so it complements the body in both men and women, for that matter. So there's all kinds of reasons why I liked naturopathic medicine and fertility awareness. It just appeals to getting to the root cause and starting a dialogue about what's going on. Why are we unhealthy? Why do we have unbalanced hormones? So, sorry, long answer to a short question.
No, I really appreciate you taking the time to share. To be honest with you, what you described is something I've read about in books. Being knocked out when you're having a baby, that's how they used to practice medicine. And I guess it's a little jarring for me, because I've only read about it in books, to actually hear that your grandmother had that experience. And so for the listeners who may never have heard of that before, that was common practice when a woman would go into labor. And it seems like it was based on the belief that her body wasn't capable of doing it herself, that she needed to be medically managed, and they needed to actually go in and basically pull out the baby. And obviously you can't do that when she's awake, or wow, it makes my blood boil as well.
So anyway, so I was born natural. So thanks, Mom and Dad, for fighting for my natural birth. Anyway.
Yeah. And for all the men out there who are, now very involved in the birth process, to imagine being, not to be allowed to be present is just, so that stuck with me from your story. So, thank you for sharing. Fortunately, we've come a long way. We still have a ways to go. But so as you mentioned, you are bringing this amazing marriage of naturopathic medicine and fertility awareness kind of to the forefront. And so, to get our conversation started, I'd love for you maybe to talk a little bit about NAPRO technology and, the way that the knowledge is typically applied from a medical perspective, and then how your approach is different.
Sure. So NAPRO technology is short for Natural Procreative Technology. And the name isn't broad enough for me because it's not just about making babies. NAPRO technology is gleaning information from a fertility awareness chart, or with my training, a fertility care chart, and finding out when you should time a blood test, when you should time an ultrasound, when you should time a prescription, and what is the correct dosage. And it's tailor-made to each individual woman. Well, naturopathic medicine believes in individualized treatment. So this goes hand in hand. I'm chagrined that in 2016, women's health is still forced into a 28-day model. I think I've only met 3 women in my life, and I'm 54, who've had a 28-day cycle, month in, month out, month in, month out, month in, month out. That's it. I've met 3 women in my entire life, and I've been in women's circles for many years. So the assumption is that you ovulate on day 14. Well, I can give some stats that only 13% of cycles ovulate on day 14. And then women are told to test for their progesterone or the mid-luteal hormone levels, because you want to be roughly halfway in the second half of your cycle. You test day 21 hormones for progesterone and estrogen. The 2 should be done. I like to sort of remind that to listeners. And because estrogen works hand in hand with progesterone in maintaining the lining of the endometrium, if you want to support a pregnancy. And so this 21-day blood test is highly inaccurate because only 13% of women ovulate on day 14. So already you're going to have a distorted diagnostic picture for the woman. In some cases, the number of her progesterone might be way too high or way too low because it's done at the wrong time. Well, it should be high 7 days after ovulation, and it should start to taper off either before 7 days after ovulation or after that. So the problem with that is that women are given dosages of progesterone that are either too low or too high. This is bad medicine, very bad medicine. And I think part of the challenge of educating people about fertility awareness is that we have a very mixed up view about fertility and pregnancy. When I was growing up, there was a population explosion. People were bad. People were polluters. People were parasites of the planet. And this bias has, seeped into an appreciation just for the woman's cycle and fertility in general. And so as a result, we've been hormonally trying to suppress fertility for decades with the onset of the pill. And what we're doing is that we're suppressing knowledge. We're creating fertility illiteracy. So one sort of call to action that I like to put out there is that I'm really trying to teach medical literacy, because fertility literacy is medical literacy, and medical literacy will help us diagnose what's going on, whether you have something as very treatable as PMS or something more serious as postpartum depression. An antidepressant may be the wrong medication if you have postpartum depression. You may be low in progesterone. Well, let's start appreciating progesterone. Let's start appreciating hormonal balance and the far-ranging implications it has, like treating depression, treating epilepsy, treating multiple sclerosis, treating neurological conditions, autoimmune conditions, because the hormones aren't just about making babies. The hormones are about head-to-toe health for men and women. So with NAPRO, back to your question, you map out the cycle with a fertility awareness tool like the Fertility Care System. And it's a very robust system because it was initially invented in the late 70s for couples who want to space out and postpone their next pregnancy. So it was really, really accurate. And for people who used it correctly, it was 98% accurate in terms of not achieving pregnancy if you only use the days of infertility for sexual intimacy or spice or intercourse. Spice being sex is spiritual, physical, intellectual, communicative, and emotional. And I've posted about this a lot on my Facebook page. And so I really believe in the power of spice. Anyway, so because they became, the inventors, Tom Hilgers and his team at Creighton University, became so aware of fertility, days of infertility, they started noticing patterns saying, well, this person has too many days of infertility. You should have those healthy cervical fluid days, at least 4 or 5 days a month. And then you add 3 because the cervix is still open. Those are your days of fertility. But they were noticing interesting patterns that pointed to a hormonal imbalance. And so by looking at tens and thousands of charts, they're able to correlate infertility markers. Because the Billings, John and Evelyn Billings, were correlating fertility markers with the appearance of cervical fluid in response to rising estrogen prior to ovulation. And then I think Hilger's team was the best, I would say, at correlating days of infertility. And I think that's how you sort of, categorize the two. And so by learning about, this person has too many days of infertility, what's the underlying cause? So you start timing the blood tests. The last day of fertile cervical fluid is called the peak day. So it's not ovulation. It's the last day of estrogen rising. It's the peak day of estrogen. And I want to convey that. That's very, very important. Peak day is not ovulation. Peak day is peak estrogen day. And so what happens is estrogen drops abruptly the next day, and that triggers luteinizing hormone to hatch the egg or release the egg from the follicle. And then from 7 days from that day, that's your true mid-luteal time, and that's when you test for progesterone and estrogen. If you're low in both, then you need various strategies. So if you're low only in progesterone, then maybe an HRT model might be warranted in the medical model. If you're low in both, then you need maybe an FSH analog like HCG, which can mimic follicle-stimulating hormone, which will in turn help raise both estrogen and progesterone. And these are timed in cooperation with the woman's cycle. Very, very important. And then if the person wants to get pregnant, then I find the Creighton model and NAPRO are the experts at knowing levels for progesterone to maintain a pregnancy. This is not shared with patients in Ontario, where I'm from. I find this most distressing. The assumption is that when you get pregnant, it's the placenta that sort of gets front row center for all the attention it gets for producing progesterone. What isn't really well known is that the corpus luteum will pump out twice as much progesterone than the placenta throughout pregnancy. So it goes to show that it's not just the placenta pumping out the progesterone, it's both ovaries, but especially the corpus luteum. So imagine if you have been struggling with fertility, if you're told you couldn't get pregnant, or you had irregular cycles, or you've been trying to get pregnant and nothing's happening, or you've had repeated miscarriages. It behooves our medical establishment to test for progesterone. It's a $16 blood test. Think of the grief, the suffering, and the cost to society if we can prevent preterm birth. So I feel very, very strongly about helping my patients monitor their progesterone throughout pregnancy. And if their doctor won't order it for them, then I will, but they have to pay, $16 plus, it's like $18. So that's just the cost. But I think this is critical. So this is why I loved the training I got as a naturopathic doctor and as a NAPRO technology as well, because they really merge the two in terms of being the best diagnostician for hormonal imbalance and then being the best case manager for managing optimal hormonal balance, either being pregnant or not.
Mm-hmm. Well, yes, thank you for that. And I want to talk more about progesterone. I found a bit of a theme in some of my client work, a disturbing one that frustrates me. So, some doctors aren't really looking at progesterone just like you've talked about. And I definitely I have a lot of questions to ask about progesterone. But maybe you could just touch on the problem with doctors who are fully willing to prescribe progesterone and giving their patients little to no instruction as to when to take it. And even themselves having very limited knowledge, knowing how to basically identify when they should be taking it, let alone the correct dosing. So just what you were talking about kind of initially when you talked about progesterone was that if you're not testing it, let's rephrase that. If you are testing for it, but you're testing it based on your understanding of the cycle, which is that all women's cycles are 28 days, then you're testing on day 21, which, as we've already discussed, is a completely irrelevant random day. It's kind of the same thing as if I just go out and like pick a straw out of a hat.
Yes.
It's the same idea.
Yes.
And so then not only are you not instructing the women on when to correctly apply the progesterone, but you are not using the correct testing to even determine their actual level of progesterone. You can see where my frustration lies.
No. The world's changing slowly, but no, it is a challenge. But anyway, thankfully, thank you for people like you who are promoting literacy, and I think you have 85,000 listeners. I think that's what you told me. I mean, the
podcast has been downloaded over 230,000 times.
Wow! Okay.
And then last month I had 35,000 downloads.
Okay,
so someone's listening.
Yes,
Hi out there. Thank you.
I know. I'm delighted. So basically, the protocol that the NAPRO technology system teaches us is that you want to test as a very basic assessment is peak plus 7. So 7 days after estrogen peak day. And so that's exactly the mid-luteal level. And you want a progesterone level at peak plus 7 around 60 nanomoles per liter in Canadian measurements, or about 22 nanograms per milliliter in American measurements. And if you look at a blood test result, the range they give is huge, just huge. I mean, I've just given the number. Peak plus 7 is 60 nanomoles in Canada or 22 nanograms in the United States. Well, the range for that 60, they put 5.3 to 86 is an ideal range for luteal progesterone, or in nanograms, the ideal number is 22. It says, the range is 1.7 to 2.7 to 27. So it's too big. I mean, what is that range? It's not diagnostic at all. But I am giving a diagnostic number. You want it at 60 nanomoles per liter. That is a good, healthy corpus luteum pumping out a nice amount of progesterone at peak plus 7. That's the magic number you want. If you have PMS, if you've had repeated miscarriages, if you've had other hormonal challenges, that's the number you want. If that number is way below it, then let's find ways to raise your progesterone. So I'm going to talk now as a naturopath, because before I was talking as sort of a NAPRO fertility care person. I always like to find out, why are you low in progesterone? So HRT has a very important role, but it's not the whole picture. So when I do an intake with my patients, I give them a form to fill out beforehand called a review of systems. And basically, it's a description of what's going on from head to toe. So let's start with the face. Do you have psoriasis, for instance? Do you have eczema? Do you have seborrhea? Well, psoriasis and eczema can lower progesterone. So I get very excited as a naturopathic doctor. I could say, okay, you could take progesterone, or let's try and manage your psoriasis and your eczema. How can we do that? So are there certain foods that are triggering that reaction? In botanical medicine, there's a herb called burdock, for instance, which is called a blood cleanser, which can be good for skin ailments. It also raises cyclic AMP, and cyclic AMP is one of my favorite molecules. But if you're low in progesterone, you tend to be low in cyclic AMP as well. Cyclic AMP is a second messenger, which is involved in turning on hormones. So let's rebuild the body. Let's look at a potential root cause for low progesterone. Let's see, this person has psoriasis and PMS and repeated miscarriage. Let's help. Maybe burdock could be something to help their skin and help with their fertility as well. Let's keep going. How's your blood pressure? Oh, you have high blood pressure? High blood pressure is correlated to low cyclic AMP. maybe if we manage your blood pressure through mild diuretic foods like parsley or raspberries or blueberries or asparagus, let's, reduce the blood volume gently. There are very gentle diuretic teas. There are very gentle antihypertensive herbs like Crataegus. Crataegus raises cyclic AMP. So you see where I'm going with this. Just keep going. Imbalanced blood sugar. Is there diabetes in your family? Diabetes is low in cyclic AMP. So, and on it goes. So there are all kinds of reasons or processes in the body that can hinder progesterone. Let's look at them and let's work with that, because I find I get the best results when I mix HRT and naturopathic therapies. I haven't even talked about traditional Chinese medicine. Let's talk about that. Sometimes I can't come up with a Western diagnosis. I just cannot explain in Western language why you have low progesterone. But I do a TCM assessment as part of my intake. I look at the tongue. I feel the pulse. I ask all kinds of questions about energy. How is your energy morning, noon, and night? How is your sleep morning, noon, and night? What flavors do you crave? What moods do you have? In Chinese medicine, pattern recognition leads to a diagnosis. And the pattern could be, I hate bitter foods. I'm pissed off and I can't sleep at night. And that can lead to a picture or a diagnostic result of liver yang rising, for instance. So herbs that are very good for the liver can include something like dandelion leaf or milk thistle. And these herbs raise cyclic AMP. And they'd be very good for the liver. And so you can see how I can mesh the two. What's very, very important in fertility in a TCM picture is kidneys, kidney yin and kidney yang. Are you fearful? Do you have low energy in the afternoon? And these could be, point to a weakened kidney, which in turn can weaken fertility. So there are all kinds of many roads lead to Rome, if you wish, and there's all kinds of ways of merging pharmaceutical medicine and naturopathic medicine to achieve a hormonal balance. Mm-hmm. And there's one more thing. My pet peeve with TCM texts is that they also use a 28-day model. That drives me crazy. So working with my patient's chart, I'm going to say, okay, there's phase 1, 2, 3, and 4 in Chinese medicine in terms of the menstrual cycle. So we're going to just adapt to you individually. And your phase 1 and 2, which is pre-peak, might be very, very long. That's okay. I'm going to work with that. And then when we've reached ovulation, then I'm going to introduce phase 3 and 4 in terms of your treatment. And this can help with implantation. This can help with ovulation, because there are acupuncture protocols that help with releasing the egg. And then it helps with conception, and then they help with implantation. And I'm going to time those acupuncture protocols where the woman's at in her chart and not some 28-day model. So there we go.
Yes. Oh, yeah. There's so many applications of it, actually. And I think the fact that TCM then works within a 28-day model can be concerning, because obviously, I interviewed Jani White. She's an acupuncturist. She lives in the UK, and she actually took us through the Chinese medicine, kind of the way that the menstrual cycle is looked at, talked about all the different parts of it, and also informed, the audience about what you can do within each part and why it's important then to target the care based on what part of the cycle that you're in. So, I would hope that if you're seeing a traditional Chinese medicine doctor, that they wouldn't be arbitrarily applying those things based on the 28-day model. Oh, by the look on your face, I'm guessing that happens.
Well, it's how it's taught. It's how it's taught. I don't know. I mean, I can't speak for my colleagues and what they do in their actual treatment room, but there is a day 7 protocol. There is a day 14 protocol, a day 21 protocol. And so that's based on the assumption that we ovulate on day 14 and that the mid-luteal is day 21. Implantation, by the way, in the Creighton world happens around peak plus 9, just for people to know. And so, between peak plus 8, 9, and 10, that's sort of when you expect implantation to occur. And so I'm going to do acupuncture protocols for implantation around peak plus 7, 6, 7, 8 to help with implantation a few days before. Just really enrich the lining of the uterus and encourage implantation. So that's how I sort of design my protocols. It's based on the woman's chart.
Okay. Well, obviously that makes a lot more sense. And so one of the questions I get a lot is around progesterone. I think that for women who are trying to conceive, who are exposed to this knowledge, it's starting to be on the radar. Okay, now I think I have low progesterone. So let's talk a little bit about what it could look like in her chart if she does have low progesterone.
Sure. So there's all kinds of scenarios. I think the easiest one to spot quickly is that she has what we call a very short post-peak phase. And so ideally your post-peak phase is anywhere from 9 to 16 days. That's a good range. I like 10 to 15. That's what I aspire to when I treat my patients. But if it's less than 9 days, that's considered a short post-peak phase, and that can indicate low progesterone or low estrogen for that matter. But so that's one example of low progesterone. Now, you could have, let's go back to a 28-day cycle. You could have a post-peak phase that is in that range of 9 to 16 days. Let's say it's about 12 days, but you've only had 1 or 2 days of that cervical fluid, that white flow, as we call it in some circles. If you only have 1 or 2 days of cervical fluid, that means your corpus luteum didn't grow big enough, probably didn't rupture, and so a small corpus luteum or a small follicle from that corpus luteum means you have a small amount of progesterone, because they correlate to two. Low estrogen, low corpus luteum function will result to low progesterone function. So even though the cycle is, you have a post-peak phase of 9 to 16 days, the blood test will probably reveal low estrogen and progesterone. So that's another indicator, is that you have a short post-peak phase or limited cervical fluid prior to ovulation. Another indicator of low progesterone is spotting before your period and spotting after your period. Because spotting before your period means that your progesterone is dropping prematurely, and so you're having withdrawal bleeding. And then spotting after your period means that you have both low progesterone and low estrogen. Because you have what you have called breakthrough bleeding. So those are some of the charting observations you could make, and you can start correlating those observations to, you could predict a blood test based on that information.
Well, and that's the direct application of using the chart as a diagnostic tool that we're taught to some degree in our Justice training, because the Justice model was based on the Creighton model in the sense that we use the same charting language, you could say. And that degree, I know some of my clients will ask me like, well, why do I need to know all of this stuff? Because there's all these little markings and everything. But the amount of information that it gives you, it really, like you talked about at the beginning, kind of figuring it out. You're wanting to be a little scientist and figure out what's happening. And it really allows you to get those clues around what's going on. And one of the things that you mentioned as well, and I think it's really important, because when you're not working with a practitioner who's been trained in how to help you, look at your charts and actually see. So there's a couple different things that it makes me think of. One is what I always say, which is you don't know what you don't know. And I did an interview with Eileen Richmond, and she said it really, really great. She said, you can learn to chart and chart your own cycles, but it's kind of like if you learn to drive and you learn to drive like your own standard car, because you can drive your own, but you don't know what someone else is doing. And so then if you're not working with someone who's able to review the charts, then you really don't know what you're not picking up. And so you touched on low estrogen. And I think going back to the most basic anatomy lesson of how estrogen and progesterone are predominantly produced in the body. So, in the pre-ovulatory phase, estrogen is produced by the follicle on the ovary. And that exact same follicle then ruptures when a woman ovulates, and that exact same follicle turns into the corpus luteum. So you painted a really clear picture that if we're not producing enough estrogen, then it means that it's not forming properly. And then, of course, the corpus luteum isn't forming properly because it's the same cell.
Yeah. When I was in school, estrogen dominance was a bad word. I mean, this was in the late 90s at the Canadian College of Naturopathic Medicine. Now I'm seeing low estrogen and in my practice. It's a different world. It's a very, very different world. I use the term white flow because what I found sad about the pill culture is it prolonged fertility illiteracy, and it prolonged a lack of interest in fertility awareness. And it's only because of the ecological effects of the pill, I think, that's one of the reasons, that people are much more interested in learning about their bodies. And so I use the term white flow because white flow is produced in a fertile woman and a fertile man. And I had to give a talk to my high school this year about human reproduction. I want to make it very scientific. I said, this is how human reproduction happens. So I was invited to 2 biology classes at the Toronto French School. And the first class, happened to be all girls. So I'm talking about the chart, and I'm talking about cervical fluid and blah, blah, blah. And a third of the girls in the class were on the pill because of acne. And I know, cringe. And so, and I think that the statistic is 22% of pill prescriptions for teenage girls is not for birth control. 22% is for acne, painful periods, irregular periods, no periods, and it suppresses the knowledge that the body's trying to give out there. So I'm saying, I need help. I have a hormonal imbalance, and it's trying to just push women or girls into a 28-day cycle. And I'm saddened when I hear parents say, well, I put her on the pill because she has acne, but I don't want her getting pregnant. And I'm thinking, okay, this is a double whammy. She probably can't get pregnant, number one. And number two, you just introduced a 12-year-old girl, let's say, or a 13-year-old girl. Oh, yeah, you're not getting pregnant. Well, that's the last thing she had on her mind. She wants to deal with her acne. And then you don't give her a chance to learn about her body and learn about fertility literacy. So it's just like, let's censor fertility and let's just put her on the pill. So long live white flow, because we need white flow. So anyway, so I'm back to this high school. So a third of the girls were put on the pill because of acne. And then the next class, it was 11 boys and 1 girl. I'm thinking, oh, okay, what am I going to do? Anyway, so through my one of my first slides is talking about the man's DNA contribution in human reproduction. It's located in the head of the sperm. And the sperm swim in seminal fluid. But before the word came out of my mouth, seminal fluid, I said, and the sperm swim in white flow.
They're like, what?
And their eyes lit up. Oh, white flow. So boys have white flow and girls have white flow. Healthy boys have white flow. Healthy girls have red flow. Because let's face it, seminal fluid and cervical fluid just ain't media friendly. And if you say that on CNN or ABC or CBS or CBC or Global or people going, ooh, but he can say white flow. So that's the title of the book I have to write, White Flow Baby, because I just think without white flow, there'll never be a baby. But why I just like the pill is that now we have less white flow in men and women. Sperm counts are plunging throughout the world because we have too many hormones, artificial hormones in our water supply. And I did an interview about this well over 10 years ago with the National Post. And the comment from, Fisheries Canada, they said was, well, we need better filtration systems. Well, why don't we have fewer artificial hormones? Because it's killing the fish population. It's neutering our animal wildlife. And it's basically making men sterile, number one. So we have plunging sperm counts. And then number two, we have plunging white flow in women because they're not ovulating. And they're not ovulating because the corpus luteum is probably confused because we have so much hormones out there saying, oh, well, I don't need to make more estrogen. We have tons of estrogen in our tap water. So long live white flow. And let's celebrate white flow because it means we're healthy and it means we have fertility literacy if we know what white flow is. That's the message I want to get out there is that let's celebrate fertility because it means you're healthy. And it means we have half a brain. That means we are literate. And so that's, a cultural change I would love to see, if there was less pills in the world. And let's find a natural cure for acne and not put someone on the pill. So.
Well, and in my interview with Dr. Jerry Lynn Pryor, she spoke specifically about the length of time that it takes for a young woman's body to develop. We all know, we see kids growing up. We know that a 16-year-old is not fully developed, whether it's a boy or a girl. If you look at teenagers, their teeth are kind of big for the face and their ears are kind of... My husband works with youth, and so he'll often say, you can tell how old someone is by looking at, how their teeth fit in their face. And so we have that general understanding that, teenagers are, little people, but they still have a bit of time to grow. And they're still not fully mature, but for some reason we don't think about the menstrual cycle. And part of it, one of the things I find myself saying with my client meetings so often, and I do the most basic anatomy lessons, in terms of the vulva, this is where your urethra is, this is where your pee comes out of. No one ever told us that. Mm-hmm. I mean, I have 2 little boys running around, their little penises flinging in the air. They know where their pee comes out. It's more obvious. But for us as women, we don't know the most basic stuff. And so it's so problematic that because the parents don't mean to do harm. Mm-hmm. And I mean, we could have a conversation about that too. I mean, you're putting your daughter on the pill because of acne, but also it saves you from having a conversation around sexual activity. It's easier to throw her on the pill than actually address the fact that a conversation is required. So that's a whole other tangent that I thought of. But I guess in your practice then, I mean, from everything that you've talked about, it's pretty clear how this knowledge has informed your practice. And I know that you work in an integrative practice. And so maybe you could talk just a little bit more about the integration of these techniques, how you've seen it throughout your career, and maybe even your aspirations for the future. There's so much potential, between medicine and naturopathic medicine to utilize this knowledge and really support women's hormones and their fertility and their health.
Mm-hmm. No, I'm glad you mentioned that. The reason why I started referring some of my epilepsy patients to NAPRO doctors in Toronto is that when we started talking about when they had seizures, a lot of the time they'd have seizures, what they would say in the second half of their cycle or before their period. And so in very layman's terms, this was the post-peak phase. This was the luteal phase. And sure enough, they started charting with a fertility care practitioner. And sure enough, they were low in progesterone. So I started thinking, I said, wow, progesterone is so interesting. It's in the sense that it's not just for human reproduction. It's important for neurology. And from digging around, I've uncovered over the years is that progesterone can prevent brain tumors. Progesterone is low if you have MS. Progesterone is low if you have certain types of seizures. Progesterone is low if you have certain autoimmune conditions like rheumatoid arthritis. So here we're talking about a hormone that is not just about human reproduction. But the barrier to knowledge is because people only equate it with human reproduction, that they don't want to know about it. I don't want to learn about hormones because I don't want a baby. So I'm just going to go on the pill or wear a condom. I'm going to just block it out until I'm ready to start a family. But I'm thinking, no, I hope you learn about your hormones, men and women out there, because it impacts all kinds of health parameters. And in women, I'm fascinated by the connection between progesterone and neurological health, because I see a lot of boys, girls, men and women with epilepsy. And I ask all my female patients with seizures to start charting their cycle. I say, absolutely, let's get a baseline. Let's learn about your days of fertility, your days of infertility. And I want to actually rephrase that to your estrogen days, which is the cervical fluid, the white flow, and your progesterone days, which are after that, which are the drier days. And I'm always slipping into sort of the fertility, infertility language, because that's what we've only associate these hormones for. But I look forward to the day, and one of my aspirations, as you referred to, is that hormones are viewed as body health. It's not just about human reproduction. Hormones are viewed as brain health and neurological health. I think that would be a wonderful interdisciplinary conversation to have with all your patients. So I look forward to the day when neurologists take an interest in progesterone. I look forward to the day when psychiatrists take an interest in progesterone. I had a harrowing summer 2 years ago, the summer of 2014, and I was the medical power of attorney and substitute decision maker for a psychiatric patient. Many of the female patients I saw walking the halls had facial hair, had obesity in their midsection, and or hair loss. And I couldn't help from feeling that by testing their hormones and maybe uncovering a hormonal deficiency, we could have helped alleviate some of their psychiatric conditions of deep depression or PMS, even psychosis. And I just felt that conversation has never entered a psychiatrist's mind, and I'm saddened by this. So there is a psychiatrist in the state, Kelly Brogan, who is interested in sort of an integrative model, but she's a voice in the wilderness. So Kelly, if you're listening to this, I commend you, Dr. Brogan, and hang in there and keep up the good fight. But I really want to see an interdisciplinary and multidisciplinary conversation for serious conditions like psychiatric conditions, like schizophrenia or bipolar disorder. And then I really want to see a serious conversation about appreciating fertility as a health determinant and not viewing pregnancy or the potential of pregnancy as a curse. Because now we're living in a world where it's polluted and we have plunging birth rates and we have pressure now on an aging population. Because I said to people in their 70s, be careful what you wish for. You have no more grandchildren because your children are infertile. And I wish there was a conversation about learning about the cycle, fertility awareness, so we can manage our fertility in a cooperative and natural way. So I want men and women to take an interest in their white flow, their respective fertility, and manage it with respect. So for me, SPICE is about sex is a communication tool. It's a spiritual bridge between the sexes. It's spiritual, it's physical, it's intellectual, it's communicative and emotional. And that you say to each other, I love you, body, mind, and soul, fertile or not fertile, but I love you head to toe, and I accept you, and I don't want to berate our shared fertility. Another thing I can't stand about the pill is that fertility is dumped on the woman's shoulders. In 2013, more Canadian women gave birth than ever before. No. More men and women gave birth than ever before. It's a shared activity. And it's not just about women alone. So women alone shouldn't be dealing with the pill or abortion. No, it's let's have men and women work together in a cooperative way. And so they can manage their fertility. And let's men and women celebrate when we have a beautiful new baby on the horizon. And so let's not pigeonhole women. And what unites them both is white flow. So let's learn to love that white flow baby. That's really what I would aspire to. So my soon to appear book, White Flow Baby.
Yeah, no, I can't wait. You brought up so many important points, and what I think is really interesting, again, alluding to the interview that I did with Dr. Jerry Lynn Pryor, she's brought a few specific conditions to the forefront and how they relate to hormones and hormone health. And so she talks a lot about how ovulation specifically, because without ovulation, you're not getting your natural progesterone, and how that's really important for bone health, breast health, and heart health. And what I love about what you were talking about as well is the intersection of the hormonal cycle, which is essentially our endocrine system. And one of the things that I always say is, we are not parts sold separately. When we are made as women, our bodies are fully assembled. And that means the ovaries are part of the deal. And believe it or not, they actually play a role in everything that's happening. And for some reason, in our lovely, I don't even know what to call it. I just have to say ignorance. In our ignorance and the medical establishment has the audacity to think that our ovaries are irrelevant unless we're talking about trying to have babies. And so the fact that you're talking about the relationship between our hormone levels and schizophrenia, mental health issues, as well as, seizures, epilepsy, and how correcting hormonal imbalances in those areas can then impact a woman's not only physical health, but now we're talking about mental health as well. I think that I hope that in 100 years people will be like, well, yeah, duh, as opposed to now this being a revolutionary concept. Because you've probably blown, a lot of my listeners' minds by sharing your experience of how these things are connected.
Sure, absolutely. No, yeah, I don't want to get too discouraged, but sometimes I just the dominant culture is all about pregnancy avoidance when it comes to sex, and so let's chemically do it or pharmaceutically do it, and so. If you only want pregnancy avoidance, then you're going to create fertility illiteracy and health illiteracy. So anyway, I shouldn't get too discouraged, but anyway, so.
Well, maybe we can switch gears a little bit as we gear down towards the, end of our pregnancy. We've talked about so many different things. And for the listeners then who, you went through and you described some of the symptoms of progesterone deficiency. And we did allude to the fact that it's not always simply low progesterone in isolation. Often women don't realize that they may also be low in estrogen and progesterone. And so maybe we could, and you spoke a little bit about some of the solutions, but maybe we could talk a little bit more about the solutions. One of the things that I always talk about, and I will continue to talk about, is that there's no simple answer. In your description of, some ways to support a woman's body to produce progesterone naturally, what you indicated is essentially that every woman is her own unique puzzle, and she might have a bunch of different things going on. So there's not just for the women listening. I mean, you can Google increased progesterone level and get like 6 supplements. I mean, it's just so much more complicated than that. But maybe you can just share and the ways, I guess, as well from a naturopathic perspective as how it differs then from the medical perspective of the application of NaPro. Sure.
Well, I like combining the two. I think there is a need for HRT. So I am thankful that women have access to bioidentical progesterone hormonal replacement therapy, because I believe in bioidentical or human identical progesterone. I don't believe in synthetic progesterone, because that synthetic progesterone can cause blood clots and it can be harmful for some women. So I think the HRT model is important. I think pharmaceutical interventions like HCG and low-dose naltrexone are very, very interesting because apparently with low-dose naltrexone, that can help raise endorphins. And low endorphins has been correlated to low progesterone. And there are opiate receptors in the ovary. So I think this is a very interesting pharmaceutical angle in terms of helping raise progesterone. So those are some of the pharmaceutical medication that you'll come across in the NaPro world. And as I mentioned earlier, HCG, the pregnancy hormone, is an FSH analog, a follicle-stimulating hormone analog. So it's quite identical structurally, and it can be given to both men and women to help increase sperm counts in men and help increase ovulation rates in women. So those are some of the ways you can help increase progesterone. In terms of naturopathic protocols, as I mentioned before, if someone has eczema, asthma, psoriasis, seborrhea, blood sugar imbalances, blood pressure challenges, seizures, multiple sclerosis, rheumatoid arthritis, I want to address those conditions. And because those conditions are lowering progesterone. So if I can help the inflammatory process in someone with rheumatoid arthritis by lowering down the inflammation, by lowering by controlling the cytokine storm, or by lowering the autoimmune mechanisms, I can help give rise to cyclic AMP production, which in turn will help with progesterone. So that's one angle. Another very easy one is allergies, seasonal allergies. If you're allergic to cats, or if you're allergic to ragweed that can flare its ugly head in late August or early September, that's going to create more histamine in your body. And histamine will antagonize cyclic AMP and progesterone. So I'll look at a protocol to help manage allergies. I love milk thistle as a herb. I love astragalus as a herb, which are very good for the immune system, for anemia, and for the liver. The liver is very important in creating something called secretory IgA. And secretory IgA is a very effective branch of the immune system that sort of mops up triggers or antigens that can bring on allergies. So you want a healthy liver to make secretory IgA. You want protein in each meal because you need protein to make secretory IgA or immunoglobulins. And protein each meal means you're going to have balanced blood sugar, which will basically not tax your adrenal glands, because adrenal glands are also involved in hormone production. You want to help. I love homeopathic remedies. I've seen homeopathic remedies clear up certain skin conditions, and then the woman gets pregnant in less than 30 days. Whereas just with pharmaceuticals, she wasn't getting pregnant. So I believe they work hand in hand. In terms of traditional Chinese medicine, I like to address kidney yin deficiency, pre-peak, or kidney yin deficiency and kidney yang deficiency. And I want to address liver yang rising and spleen qi deficiency. And those conditions would require certain foods to eat, certain botanical medicines to take, timed with the cycle, and then addressing sleep, because a weak, yin hormone means you're going to have weak sleep. So you want to definitely address the yin hormones. I mean the yin organs. And so by timing my treatments in cooperation with the woman's cycle and then instructing her on monitoring her blood levels throughout pregnancy, then we can achieve a successful full-term pregnancy.
Well, as you were talking then, there's a question I want to ask you, another topic that I want to go through before the end of our interview, but can a woman do this on her own?
Do what on her own? Sorry. Address
these issues.
Well, I mean, I'm happy. I believe in, accessible information. I find I'm happy to teach fertility awareness. I think it's a very exhilarating process. I feel I have a lot to offer, and I'm sure you feel the same way. We have a lot to offer our clients. It is complicated. It is subtle. There are over a dozen types of fertile mucus or fertile cervical fluid. There are all kinds of infertile types of discharges. There are a lot. It's complicated in the beginning. You need, I need 90 days to help someone achieve fertility literacy. And what I try and tell my patients in the process is that right now you're only thinking about baby, baby, baby. What I'm teaching you now is fertility, infertility literacy, because there's going to be a time when you're not going to want a baby. And so all these days that you're showing me, those are days of infertility. So you can have sex on those days and not get pregnant, because these are the very clear signals. And then when we're going to introduce the protocols, after we get your blood test results, you're going to notice a shift, and you're going to notice more days of fertility. And you need a lot of experience. You need some scientific knowledge, I think, and you need perspective in terms of what to look for. But I don't know. I feel I think you need, if you're struggling with fertility, I think you need someone trained like yourself and myself to guide patients to time the blood tests and time the treatments.
Yeah, there's so much to know. Absolutely. And so one of the topics that you touched on as well, and I'd kind of love to close with this today, even though it's a huge topic and we could do an entire show on it, just caveat. But I would just love for you to talk a little bit about the role that progesterone plays in sustaining a pregnancy. And you also touched on the role of progesterone in postpartum. And I think when a woman's struggling to conceive, and it's tragic if you think about it. If she's struggling to conceive, obviously there's something going on. And it could easily have something to do with, hormone levels. So for a woman who's already struggling, and then does get pregnant, one of the parts of the conversation that just never happens is what happens postpartum. Because in the best of times, when your hormones are great, postpartum is challenging for 1,000 reasons, let alone if you have hormonal issues. So I'd love for you to touch on those two things a little bit.
Okay. So, progesterone is the pregnancy hormone, and it's important to help maintain the lining of the uterus. And So what I find a little bit discouraging in Ontario is that progesterone is only monitored in the first trimester. Then after that, you're on your own. The placenta kicks in. I don't agree. I think progesterone should be monitored throughout pregnancy. And if you see a drop, this can trigger a premature contractions and premature labor and preterm birth. So, have I answered your question? I'm okay. Yeah? Is that okay?
Yeah, definitely. Because you're talking about how important progesterone is to sustain the pregnancy, not only at the beginning, but throughout.
Yeah, sure. So the numbers I gave, for peak plus 7, you want progesterone to be around 60 nanomoles per liter. And at the end of the first trimester, you want it at about 111 nanomoles per liter. And entering the second and third trimester, you want it to climb to 235, then 432, then 546. You want it roughly 540 nanomoles per liter at full term. 540 nanomoles per liter at full term. So just draw that, that line between 60 to 546, and that's the process of maintaining a pregnancy to full term. Now, just so for some interesting data here, if you did a blood draw of a woman who just given birth from her arm, the progesterone would be roughly 450 nanomoles per liter. If you did a C-section on this woman and actually did a blood draw on the vein, on the ovary without the corpus luteum, it'd be about the same, about 440 nanomoles per liter. But the ovarian vein with the corpus luteum, it'd be double. It's 880 nanomoles per liter. That corpus luteum is pumping out progesterone throughout pregnancy. I want the medical community to repeat this after me. The corpus luteum pumps out progesterone throughout pregnancy at twice the levels of the placenta. And so this is very, very important. In terms of postpartum depression, if you had any of those things prior to getting pregnant, limited cervical fluid, a short post-peak phase, spotting before your period, spotting after your period, you could be a candidate for low progesterone prior to getting pregnant, and you could be a candidate for postpartum depression after birth. And so what I like about charting is that it can be a predictive tool, maybe for future challenges. If depression runs in your family, and if you've had any of those gynecological traits that you've noticed in your chart, this could make you at risk. And so why not learn about it way before you get pregnant and then monitor your progesterone levels after you give birth? And that can be a wonderful preventative tool for very serious conditions like postpartum depression. And
so then if a woman is suffering from postpartum depression and it's identified that she has low progesterone levels, then it is possible that doing a bioidentical replacement of progesterone or supporting her body in a different way, depending on her individual situation, to produce a healthy progesterone level, that in of itself can lessen her postpartum depression symptoms. Absolutely. Well, that's pretty incredible, considering how many women, friends of mine, it's the kind of thing, it's kind of like miscarriage, where until you have one, you don't realize how all of your friends had them too, because people come out the woodwork, right? Sure. It's kind of similar with postpartum depression. People don't necessarily talk about it, but once you're a mom and then you start talking to your friends, all of a sudden it comes out of the woodwork. A lot of women are struggling with this.
I think society has a challenge in terms of how to deal with miscarriage. I call it pregnancy loss. If you lose a pregnancy, or if the pregnancy stops or pregnancy ends, it's pregnancy loss or reproductive loss. It's a loss for men and women. And too many people feel uncomfortable with that. But I think I'm optimistic on that note, is that there is more openness. There are people coming out saying, no, we were parents, very briefly, but we were parents, and we've lost our future child. And so I'm glad that conversation's happening. Yeah, I'm optimistic about that, actually. So,
Well, we've talked about so much today. Our conversation, I think, is and will continue to be mind-blowing for our listeners. So out of everything we talked about today, what is one thing that you would want our listeners to really take from this conversation?
That pregnancy avoidance will create body illiteracy. Body knowledge is fertility knowledge. Let's stop viewing fertility as a burden. Let's start viewing fertility as part of human health. We shouldn't be celebrating plunging teen pregnancy rates. We should not. Plunging teen pregnancy rates means we have plunging fertility rates. We have a twisted view about fertility. If teens are having sex, they're going to get pregnant. So we can either say, let's postpone sexual debut. If you don't want to have teen pregnancy, let's postpone sexual debut. This is a very viable public health initiative. Or let's celebrate teen pregnancy rates, because you can't have it both ways. Because you have plunging teen pregnancy rates, you have plunging infertility rates.
And the studies keep showing that when you actually talk to teenagers, because teenagers are people and they're not, that's a whole other conversation, but when you actually educate teens about sex in a proper way, then the pregnancy rates do decline, because you're giving them the knowledge and information to be able to make decisions. So
body literacy.
You teach kids to drive and they don't run into trees and stuff. So there's some
white flow, baby.
There you go. So 2 more questions to end the show then. What would you say is the biggest myth about fertility that you would like to see corrected?
Oh, that you can get pregnant every day.
What, you can't? Oh my God. Get me started.
Yeah. Oh, this is really interesting. This is very, very interesting. Libido. There's been so few studies done on female libido. You'd think there'd be more. You'd think people would be interested in women's libido. Because anyway, so there was a study done in England, I think in the 1950s, about libido in married women, because that was the custom of the day to talk about sexually active women. Women can have high libido any time of the month. And this is another thing why I like about charting, is that I'll ask women about their libido. And they come to me and they want to get pregnant, but they have no libido during their fertile days. I'm sorry, I shouldn't say this, but their estrogen days or their white flow days or their cervical fluid days. They don't have any libido. They have libido when they're not fertile. And so I want to explain to them, I'm saying this is healthy and normal. And one thing I've noticed with libido is that for some women, progesterone can make them feel a little bit blue. So with rising progesterone in the second half of the cycle, this can make some women blue, or it can make some women feel very comforting and quiet and confident. And so with some women, the libido goes down, and some women, the libido goes up. During a woman's period, some women have very high libido. And I think if you're one of those women that feels blue with high progesterone or before your period, the sudden release of all those hormones and the sudden drop in all those hormones make people feel, light, happy, confident, and their libido goes up during their period. And then some women have very high libido when they are fertile, because estrogen gives them a sense of confidence. So where am I going with this? Confidence seems to be a big component of women in libido. And I think if you keep degrading pregnancy and keep degrading fertility, and you keep pigeonholing women as being the only instrument of fertility, you're going to erode women's confidence. And so that's a big message that I like to give women, that's saying, you know what? You can have libido any day of the month. It's not related to reproduction, but by knowing your reproductive hormones, it can give you, a trigger to appreciate your hormones and appreciate your potential fertility, and appreciate the fact that we are sexual beings and we don't just have sex when we're in heat. We don't have sex just because we want to make a baby now, like bears or dogs or cats, that we are nuanced beings and we have sex for love, affirmation, confidence building, bonding, because it takes, a loving man and a woman to raise a healthy child. And it takes a love of a man's white flow and a love of a woman's white flow to appreciate their shared fertility. It's a shared exercise.
I love that on so many levels. Thank you so much for sharing that. I think that description, a lot of women are going to resonate with that, because they might be feeling weird. Like, I don't always feel aroused during my fertile window. And a lot of women fully feel the most aroused around their menstruation. So I love that description. I really appreciate you sharing that. So final question of the day then, for a couple who's struggling to conceive, what advice, if any, would you give to them?
Well, do you have white flow? That's my question. That's a big question. Do you have white flow? Learn about your white flow. The basics. Quit smoking, please. Exercise, protein at each meal. But learn about your hormones. Start charting. Start charting with someone like Lisa or Nora. Learn about fertility awareness, learn about hormones, and consider. There's so many. I haven't even talked about all the prescription medication that lowers sperm counts. That's another show, maybe another show on male fertility, but there's all kinds of prescription medication that lowers sperm counts. There's all kinds of pollutants that lower sperm counts. There's all kinds of, plastics that can disrupt hormones like thyroid function and ovulation in women. So, be aware, read up, be aware, and find someone you like that you want to work with.
Okay. Well, Nora, I can't thank you enough. This has been a lot of fun, and it's been super fun to have you actually here. That's been really, really great. You have shared so much important knowledge and information in our podcast. I'm so excited to share this episode with our listeners. I'm sure it's going to resonate so much with listeners, with my clients, because it's so incredible being able to work with some of my audience members, because it gives me a really clear insight into what they want to know more about. And so I know that this episode is going to resonate with a lot of my listeners. So thank you so much for being so generous with your time today. And for our listeners that want to learn more about you and your practice, where can they go to find information about what you do?
So I have a Facebook page, I have a LinkedIn page, and I'm building my website, norapope.com, and I'm building a website, whiteflowbaby.com or whiteflowbaby.ca. And you can reach me, and I do monthly introductory sessions for the fertility care system, or the charting system that I use to help people assess their hormones. And I practice in the Rosedale area of Toronto.
Okay, so for you Torontonians, we're local today. So thank you again for being here. It was so much fun.
Thank you, Lisa.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode at fertilityfriday.com/106. And oh my goodness, I hope that you enjoyed my episode with Dr. Nora Pope as much as I did. It was a treat to have her in my home and to actually do the episode in person the first time I'm doing that. That was so nice. So thank you, Nora, for suggesting it. It was just so great to have an opportunity to chat with you in person and to connect with fellow fertility awareness educators and health professionals in my area. So that was really awesome. And beyond the awesomeness of doing the interview in person, the topics that we touched on today, they're so important. And I've seen how it can play out. I've seen it in my work with clients. I've seen it in my group program. And it's a real problem for women who are seeking support for fertility-related issues when they're wanting to get answers for what's happening in their cycle. They're wanting to know what their hormone levels are like, and if they're normal or if they're abnormal, and if they are abnormal, then how to go about it to improve those levels. And it's a real problem, and it's a really real issue that doctors will send women to do testing to test their progesterone levels on day 21, when for most women that is really a shot in the dark as to whether or not it relates anywhere close to the point in the cycle where it's supposed to be. And so the issues that Dr. Pope and I talked about are real and they're significant. And I was really happy to talk to Dr. Nora about these things to really highlight how important it is to have testing done at the appropriate time in the cycle, to understand what the tests are trying to measure and make sure that they're done at the right time, and to be completely honest about it, which is that if you go to your doctor and you tell them, well, I know that I typically don't ovulate before day 14, and so can I get back to you and tell you what day of the cycle would be better for me? Your doctor may give you a whole lot of pushback, and they may not even allow you, so to speak, to have that test done on any other day other than day 21. So, I often suggest that my clients find creative ways of describing this to their physicians so that they can ultimately get the test done on the right days. So however creative ways that you need to discuss this with your physicians. But it's important to understand what those tests are, and important to understand that they're essentially useless if they're not done on the right day. So there's so many great takeaways from this interview, and I hope that you enjoyed it. And I'd love to hear from you. So if for those of you who are listening that aren't part of my private Facebook community, I would encourage you to go to fertilityfriday.com/community. And that's the private Facebook group that I host for the Fertility Friday community. And so I would love to hear your thoughts on this episode in there. If you have ever taken a 21-day progesterone test, or if you've ever been ordered a bunch of hormonal tests, and now after listening to this interview, you realize that they probably weren't done on the right days. I'd love to hear your experience, and also if this episode has inspired you to perhaps go about some of those tests a little bit differently. So head over to the Facebook community and chat in there about the episode. Let me know what you think. And I would also encourage you, if you've been listening to the podcast for a while, to look for it on iTunes and leave a 5-star review so that more people can find it. And make sure to head over to fertilityfriday.com and join my email list. So when you join my email list, you will receive a free copy of my ebook where I reveal what to expect when you're coming off of hormonal contraceptives. And I also share 5 steps to restoring healthy menstrual cycles post-pill. And also, if you have an idea for a podcast episode or a guest suggestion, make sure to send me an email at info@fertilityfriday.com. It really helps me to continue having great guests on the show and doing episodes that I know that you're interested in hearing, because that's the point, to make sure that I'm doing episodes that are helpful, useful, informative, and that really serve the Fertility Friday community. And so I just want to thank you again for hanging out with me today. I really appreciate all of you for taking the time to tune into the podcast, to let me be part of your day, to take me for a walk with you, or on your commute to work, or on a run, or while you're washing the dishes. So letting me be part of your day. And as always, until next time, be well and happy charting.